Many of us know what it's like caring for a loved one who is going through cancer treatments. It can be very difficult and overwhelming, particularly over the last 2 years of the pandemic. Vicky Bricas knows firsthand what it's like to support a family member going through treatments at the MUHC. She supported her late father through his cancer journey. She joins me now to talk about that experience. Vicky, thanks so much for joining us on the show.
Hi, Tara. Thank you for having me.
So let's begin with your dad, Vicky. Tell us a little bit about him.
Yeah, my dad's name was Michael. He was wonderful. He was a great dad to my brother and I. He was our friend also, which was super nice for us. My mom and him were married for about 42 years, and
Wow.
yeah, they had a nice story. So we miss him. He was
Yeah.
wonderful, kind-hearted, and yeah, I mean, we're doing this in his memory, but for other cancer patients.
Let's talk about when he was diagnosed with cancer. What kind of cancer did he have, Vicky?
So my dad was diagnosed with the cancer of the ureter. The ureter is that little tube that connects the kidney to the bladder,
Okay.
and it later metastasized to the bladder, and at the end it was pretty much all over the place. So yeah.
And how long ago was he diagnosed?
He passed away 4 years ago, and his journey at the cancer center was for about 2.5 years.
Wow. Vicky, I know this is going to be a really lovely conversation because my dad passed away 4 years ago from cancer. 4 years ago next month, actually.
Oh my
So I
gosh,
feel
I'm
like,
sorry.
yeah, me too. I'm sorry for you. I know it's such a huge thing to lose your father. Tell us about his cancer journey that you mentioned at the MUHC that lasted for 2.5 years. What was that like?
Oh my goodness. I can't even start to praise the team at the MUHC's Cancer Center. Everyone was so wonderful and so caring and so human. From the doctors to the nurses to the PABs, the technicians in radiation oncology. Our family is just so grateful to them forever and ever and ever. I quite frankly, I just can't put the words to it. They were just so wonderful. Our healthcare system is a good one once you need the system like we did. And the faces behind it are just so genuine and wonderful. So my dad was well taken care of, and so were we as a family.
Wow, that's so nice to hear. I feel often we hear stories that can be contrary to that, that where it was difficult to access services and things were tough, but it sounds like you had such a nice experience.
We did. I mean, we became, for over 2.5 years, we actually became friends even with his medical team because they were so invested in his care and in his healing. I remember when, at the end when the palliative team came in and gave us the news that
Yeah.
his oncologist, which was Dr. Asila, was with me, and he just started crying, and at that moment, I'm like, wow, it was so moving for me because it was someone that he was losing as well. May not have been his dad,
Yeah.
but it was really nice to see, given even under those circumstances.
I remember that moment too, Vicky, when they come in and the palliative care team, has to let you know that this is the phase that they need to be moving in towards. It's a beautiful time, but it's such a difficult time. It's a difficult time to know that's where the path is going. We're speaking with Vicky Bricas, and we're talking about her decision to fundraise for the MUHC Social Services Department after the death of her father, Michael. So, Vicky, we've talked about it on the show before, trying to make people aware that MUHC social workers are available to help all patients. When did you learn about that?
I did not know about the the social services at the MUHC. Quite frankly, how I learned about them was through going with the treatments with my dad. I would sit at the chair with him and by him and by his side, and we had the iPad from home, we had snacks from home, just a bunch of distractions, and I just keep remembering noticing a gentleman that was there by himself across my dad. It happened that we were perhaps on the same schedule as him. And we saw him a couple of times. He was alone. There was no distraction. There was no snacks from home. And I just remember feeling just so bad for him. And after my dad passed, I went to the hospital and I spoke with Anne, who's the assistant head nurse at the cancer center. And I wanted to fundraise for something like distractions, like an iPad or something like that, for cancer patients that didn't have
Yeah.
the support system my dad had. And, right away she's like, Vicky, forget about the iPads. What I need is, money for transportation to get my patients in the door to get treatment. And I just was so, taken aback because I didn't think that that was even an issue. And she explained to me that through social workers, they identify patients that don't have the means to make it to the hospital for treatment.
Mhm.
And I just remember being just shocked at that. So,
Wow, that's
um,
so interesting. I feel you telling that story, seeing a patient who didn't have the kind of love and support that your father had. It moved you so deeply that you really wanted to make a difference. So you're launching your personal fundraising page. Tell us about that.
so our family is going ahead with this fund. It's to fund the social services cancer arm, if I may call it that. I'm not too sure.
Mhm.
So it's basically to pay for essentials for cancer patients that don't have the means. For example, groceries, hydro bills, TV or whatever the social services deem necessary to be paid. Transportation, of course, as well. Childcare, because we forget sometimes that cancer just doesn't affect older people. It affects young parents that don't have the means to pay for, childcare services because their salaries are not what they used to be because they're sick, which is something I never even realized until I spoke with McGill at the foundation.
Mhm.
Groceries, bare essentials that we don't think of either. And it's important going forward. So the fund is we're starting it off, but our fund is going to be called Us for Them. Us is basically a community that has been touched by cancer. It's not just our family. It has touched many families, unfortunately.
Mhm.
So we want to be the support system for those patients going through cancer.
That's so lovely. I want to explain to our listeners what a personal fundraising page is. It's essentially something that anyone can do, raise money through the MUHC Foundation for a cause that is meaningful to you, the way this cause is meaningful to Vicky. And you can just head to the MUHC Foundation website, look under ways to give. There you can find Vicky's personal fundraising page, her family's. You can start your own. It really is a lovely way to give back. Vicky, how do you think your father would look down and see what you and your family are doing in light of the experience that he had there? I know it's a tough
Um,
question. I know.
yeah.
I know it's a
You
tough
didn't
question.
prep
I'm
me for
feeling
this
it.
one, Tara.
I know. I'm feeling it because I honestly I feel super. I know we're talking over the radio, but I feel we've had similar journeys and the timeline. But I know like
um,
you think about my dad every day. I'm sure it's the same with you, especially now with what you're doing. But what do you think he'd think?
I think he would be super proud of us all, and just he was all a very generous man. So I think this would be super important for him as well, and to want to be able to give an equally fighting chance to all cancer patients, because that's important. It doesn't discriminate, as we all know, based on socioeconomic status, but it does come with financial burdens that not everybody is able to meet. So it's important that we're there for everyone that's going through this, and they all have an equal fighting chance at this.
We're speaking with Vicky Bricas. She has begun a fundraising page in sort of in memory of her late father, Michael, who passed away. She's raising money for social services and all the important services that they offer. Vicky, how's your mom doing, and how does she feel about this fundraising endeavor that you're all on now?
We're all on it. It's my mom, my brother, and my sister-in-law, and my nephew, who's two, who never got to meet my dad.
Oh,
We're all going about it as we're giving back in memory of my dad. It's very, very important to us. The support system we had for him was super strong, and we just feel that every patient should have the same support system, whether it comes in our version or any version. I mean, if we can help in any way to provide a support system for these patients, it's very important for us. And I think it helps also with the grief, if I may say
mm-hmm.
so. It
Yeah,
makes it
that
a
makes
little
sense.
sweeter, perhaps.
Mm-hmm. That totally makes sense. Last question for you, Vicky. If you had one message for our listeners to know about social services at the MUHC, what would you like them to know?
First of all, that the service exists,
Mhm.
Once you're put into the system, it just goes so fast and it's so overwhelming that we don't even know all the services that are available. And there's no shame in asking, to see what services the hospital offers. There are great services out there, and we so encourage everyone to give any amount. And no amount is a small amount. I mean, with $50,
Mhm.
we can pay for somebody's bell services. We can pay for part of their hydro bill, and just this. Our goal is just to alleviate any financial stress that comes with their disease. So if we can take away that stress, then that's our goal.
Do you have a fundraising goal in mind, Vicky? Are you trying to reach this amount?
The biggest amount, obviously. uh, if we can, at this point, we're just starting out, so we haven't discussed a maximum
Okay.
amount with the foundation. But if, through grassroots and through encouraging other families like ours to join our cause, if we can raise $25,000, then that would be great. If it's more, then the foundation will let us know, and we'll happily raise the bar to whatever amount is needed. But this is our goal for now.
That sounds like a great goal. If you'd like to learn more about Vicky and her personal fundraising page, just head to the MUHC Foundation website, look under Ways to Give, and you'll find personal fundraising. Vicky Bricas, I want to thank you so much for sharing your story with us and for joining us on the show.
Thank you so much, Tara, for having me. It was such a pleasure.
Pleasure was mine.